Every year, 20 million babies are born with a low birth weight. The majority of these births occur in developing countries or situations of poverty. Being born underweight leads to high rates of mortality and morbidity, and the natural brain development of the child stops early. Kangaroo care began in Colombia, developed by Doctors Ray and Martinez in response to high rates of infection, busy nurseries, and lack of modern medical technology such as incubators. Kangaroo care is the action of skin-to-skin contact between a parent and their child for as close to 24 hours as possible, with intermittent breastfeeding. Benefits for the baby include reduced mortality, fewer severe illnesses and infections, increased temperature stability, better sleep health, increased brain development, and improved breastfeeding. Mothers feel more confident and closely bonded to their newborn. Since it began, Kangaroo mother care has been used all around the world, for example in Malawi, which has the highest rate of preterm birth. For every 100 babies born, 18.1 are preterm. Kangaroo mother care is an effective way to provide life-saving care to preterm babies in this low-resource setting. It has been well received by mothers who have babies in hospitals, and they trust the initiative. On their return into the community, they share this enthusiasm with other new mums, encouraging them to carry their newborns on the front, rather than the traditional way of carrying on the back. There has been a great effort to train staff in the practice, and Kangaroo mother care is now part of the core curriculum for nursing students. Despite this progress, there are some obstacles. Still, not all facilities have a trained member of staff allocated to supervise Kangaroo mother care, and not all mothers can be properly followed up due to long travel distances and expensive transport. Kangaroo mother care is not only used in low-income countries, it has also been successful in Sweden, where for every 100 live births, 5.9 are early. In a study where Kangaroo mother care was used in a Swedish hospital, all of the mothers were happy with it and said they would use it again. Parents were able to share the experience with each other, reducing feelings of isolation and loneliness in the period shortly after birth, though some did find the continuous skin-to-skin contact tiring when providing care at night. Is there a population with the greatest need for Kangaroo mother care? Low birth weight is higher in refugee camps than the rest of the global population. During conflict and natural disasters, the access to health services often decreases, whilst reproductive health needs increase. The reproductive health services in Burkina Faso, Democratic Republic of Congo, and South Sudan are suffering due to current situations of conflict. Just 5 health facilities in these 3 countries met the criteria to be classed as an emergency obstetric and newborn care service. In situations such as these, something as simple as Kangaroo mother care could make a big difference. Kangaroo mother care is already a success story around the world, but its coverage remains insufficient. Proper implementation of Kangaroo mother care could avoid a further 770,000 neonatal deaths every year. This is a cost-effective, accessible intervention which